Yes, the induced sputum has been very well standardized a long time ago. The European Respiratory Society produced a document, a statement where the authors standardized the technique in two parts. The first part was the induced sputum using a saline in a standardized way. And the second part is the processing sputum, starting from the plug, the mucus part, arriving to the very adequate slide where it is possible to read very well the cellular cells presented in patients with airway inflammation. Yes, induced sputum has been very well standardized for bronchial asthma, and is an important technique because, first of all, is a quite non-invasive technique to detect the direct airway inflammation, and the direct airway inflammation can present three types of inflammation in asthma. The main inflammation we can find is the eosinophilic asthma, but using induced sputum we can also detect the presence of neutrophilic inflammation, or in some cases also the paucigranulocytis inflammation, or at least the presence of mixed inflammation with the presence of both neutrophilic and eosinophilic inflammation. And so I think that these differences in terms of airway inflammation can present different phenotypes of asthma. Yes, because induced sputum has been used as a technique to evaluate the efficacy of, first of all, oral and inhaled corticosteroid to reduce the eosinophilic inflammation. But more recently has been used to evaluate the efficacy of new treatments, and as a new treatment I intend the biological treatment, and there are very good studies to demonstrate the efficacy of omalizumab and mepolizumab and other biologics in reducing the eosinophilic inflammation detected with induced sputum. Yes, there's been used also to detect the airway inflammation in COPD, for instance, and because also in COPD we have not only neutrophilic inflammation, but it is possible to find eosinophilic inflammation like we find in asthma, and in this case it's been very useful because in this case it's possible to find a very good efficacy of corticosteroid, inhaled corticosteroid, also in COPD patients. And some times ago, but it's very clinically useful, the possibility to detect eosinophilic inflammation in patients with a long-term cough, and it has been find a sort of disease called eosinophilic bronchitis in patients with without asthma with a long-term cough.